Hey guys, my name is Daniel, and today we're going to be diving deep into the anatomy and function of a key player in forearm movement, the pronator teres. This muscle originates in two places, the medial supercondylar ridge of the humerus and medial side of the ulna. This is going to be right above and right below the elbow, and is going to be the anchor of the muscle which keeps it in place while we move. The insertion is right here on the lateral surface of the radius, and yes, it is a two-joint muscle which crosses the elbow joint and radial ulnar joint. Now you might ask, what is its main job? Well, it's right in the name, pronation, and it doesn't do it by himself. It does it with a little help of the pronator quadratus to achieve it. And it's not all it does. The pronator teres also acts as a stabilizer in both elbow flexion and extension, and this is because of the points of origin. Remember I said they're both one above and below the elbow. This helps to stabilize the joint and keep all three arm bones in line during elbow movement, which includes the radius, the ulna, and the humerus. And here are some of the actions / movements that use the pronator teres that were mentioned on the previous slide. For example, turning a doorknob, typing on a keyboard, turning a screwdriver. You can see swinging a golf club or a tennis racket. You can see Tom Brady here gripping a football. And as you can see, this muscle is located in the anterior compartment of the forearm and actually has two heads, the humeral head and the ulnar head. And the innervation is supplied by the median nerve, which runs right through the middle of this muscle. So the reason this pronator teres is so significant is because it can be involved in like median nerve entrapment, leading to injury. So if these two muscles get inflamed or if they get unhappy, then you have a problem. So overuse or repetitive motions can strain this muscle, which potentially contribute to conditions like pronator teres syndrome or even carpal tunnel. So proper care and strengthening is important, but it's also important to note the difference between these two syndromes. So both of them have similar symptoms, like the area of numbness in the fingers, because they both innervate the median nerve. However, carpal tunnel occurs at the wrist and pronator teres syndrome occurs at the elbow. Now I'm going to teach you how to keep your pronator teres happy and healthy, and right now I'm going to teach you some stretches for it. So first one is a flexor stretching. That's going to be that top image right there. You're going to grab your arm right in front of you, grab the four fingers, and lightly extend your wrist backwards. The second one we're going to learn is a forearm pronator stretch. You're going to stand with your back facing the door frame and raise your arm behind you to about 75 degrees and grab onto the door frame. And you're going to want to keep your elbows straight. With your thumb pointing down, roll your bicep towards the top to externally rotate your arm. This is going to activate that pronator teres muscle, and you should feel it activating. Now, these are three exercises to prevent and strengthen your pronator teres. First is going to be this pronation and supination with dumbbells. So you're going to want to keep your back in a neutral position while you're sitting down and let your wrist and forearm rest on your lower thighs. Now hold a light dumbbell and slowly rotate your wrists up and down, as you can see in this picture above. The second exercise I'm going to teach you is the dowel wrist stars. So you're going to use a dowel rod, or if you're at home you can use a broomstick to draw stars in the sky with just your wrist. And you can see that on the dude on the image below. He's just grabbing a rod, just going to write stars right in the air. Last exercise we're going to learn is the isometric wrist rotations. So you're going to want to hold a light kettlebell with your palm side up and rotate your wrist side to side in a controlled manner. And you can also put a yoga block between your elbow and your hip just to stabilize your shoulder. Thank you guys for watching, but it's important to remember that incorporating exercises that target the pronator teres, like the wrist curls and the pronation supination with dumbbells, can help maintain its strength and flexibility. This can significantly prevent the overuse and strengthen your mobility. Thank you guys. See you next time.